Who is presenting the next one?
Myself, sir. Sir, my topic is first about laryngeal anatomy. Larynx is a segment of respiratory tract which is present in the anterior aspect of neck. It is about 5 centimeter in length and width. It has slightly shorter anteroposterior diameter. It extends from C4 to C7 vertebra, which is held in position with the help of muscles and ligaments. Superiorly, it extends up to epiglottis, which is connected to hyoid bone, which in turn connected to the inferior part of pharynx. Inferiorly, it is connected to superior part of trachea. Functions of act as a it contains vocal apparatus, which is important for communication. It is helpful to perform effective cough and Valsalva manner. Larynx is made of 3 paired and 3 unpaired cartilages. 3 unpaired cartilages are epiglottis, thyroid, and cricoid. 3 paired cartilages are uniform. Larynx is divided into 3 parts: supraglottis, glottis, and subglottis. Supraglottis connects larynx to the base of the tongue, which extends up to ventricles. Then subdivisions of supraglottis, they're epiglottis, ariepiglottic fold, arytenoid, false vocal cord, and ventricles. The mucosal lining of the supraglottis is stratified squamous epithelium. Supraglottis is rich in larynx. It takes through the thyroid membrane to the jugular digastric nodes. So the clinical significance here is cervical metastasis is more common here. Then about epiglottis, it is a leaf-shaped structure. It is made of fibrocartilage. It is attached to thyroid cartilage. Larynx and connected to valvular epiglottic ligament. Epiglottis is divided into parts: supraepiglottis and infrahyoid epiglottis. Suprahyoid epiglottis has infrahyoid is related to pre-epiglottic space. And most common. Then about aryepiglottic fold, it's from arytenoid to epiglottis. It contains corbiculate and cuneiform cartilages. Aryepiglottic fold, vocal cord, and true vocal cords. All these forms enter during the phase of swallowing. It is important for swallowing reflex. If aryepiglottic fold is flabby, this condition is called laryngomalacia. Then about glottis, it has 2 parts: true vocal cord and dimaglatis. True vocal cord is divided into anterior and posterior commissure. This is the most narrowest portion in adult larynx. It is divided into anterior 2/3 and posterior 1/3. Anterior 2/3 is membranous, which is formed by vocal ligament and muscle. Posterior is fibrous. Concerted into Broyles ligament, which is inferior spread of glottic canal. And commissure, it is the area to vocal. In male, it is formed by midline between thyroid notch and lower border. In female, it is formed by junction between upper 1/3 and lower 2/3. The applied aspect is waving is most common anterior commissure. Then about posterior commissure, it is the area between 2 vocal process. Applied aspect here is posterior commissure scarring mimics bilateral abductor palsy. Then about subglottis, which extends up to lower border of cricoid cartilage. It has 2 parts: mobile upper part, which extends up to the upper border of cricoid cartilage, and fixed lower part, which extends up to the inferior border of cricoid cartilage. Then about the difference between adult and pediatric larynx. In adult, epiglottis is firm and flatter. In pediatric, larynx is cylindrical in adult. It is funnel shaped in pediatric. In adult, the most part is glottis, which is vocal cord. Clinical significance is subglottic stenosis is most common due to the non-expansile rate in pediatrics. Then about thyroid cartilage. Thyroid cartilage has 2 lamina, which uses to form thyroid prominence. In male, it is acute angle 90 degree. In female, it is obtuse angle 120 degree. Then about cricoid cartilage, it is signet ring shape. It has two parts: anterior arch, which is 5 to 7 millimeter, and posterior lamina, which is 2 to related to recurrent laryngeal nerve. Significance about cricoid cartilage, because of its complete ring, application of pressure anterior patient. Yes, ma'am. It has commonly injured by tubes into or insertion of tube blind intubate techniques, chronic steroid use, Malaysia, Ali, esophageal the then about the both are vestigial epiglottic fold, epiglottic fold, and after vertical hemilaryngeal. Then about muscles of into extrinsic muscles are further divided into suprahyoid muscle, gastric, and pharyngeus. Function is to elevate. About infrahyoid, they are omohyoid, sternothyroid, thyrohyoid. Their function is to lower the lungs. Then about intrinsic muscles, they are divided into paired and unpaired. Arytenoid is an unpaired muscle which controls true vocal cord. Their main function is to coordinate phonation, respiration, cough reflex, and sphygmaticism. Then about the nerves of the larynx, all intrinsic muscles of the larynx are supplied by recurrent laryngeal nerve, except cricothyroid, which is supplied by external branch of superior laryngeal nerve. Cricothyroid muscle is a tensor of true vocal cord, which originates from cricoid arch and inserted into inferior border of thyroid cartilage. Its main action is to make the vocal cord thinner and longer to have to increase the voice pitch. Vocal cord has two actions: adduction and abduction. Posterior cricoarytenoid is the only abductor. Cricothyroid, lateral cricoarytenoid, interarytenoid, and external part of thyroarytenoid all are adductors. All these muscles are supplied by cricothyroid, which is supplied by superior laryngeal nerve. Tensors of true vocal cord are two muscles and vocalis muscle. Then about the clinical aspect, in recurrent laryngeal nerve palsy, vocal cord comes to median or paramedian position due to cricothyroid overactivity. Intensity of voice is related to the expiratory effort of subglottic pressure. Recurrent laryngeal nerve branches from vagus nerve in thorax and loops around or in left and subclavian artery in right before traveling between esophagus and trachea, which supplies all intrinsic muscles of the larynx except cricothyroid. Then about the clinical aspect, Ortner's syndrome, hoarseness of voice is due to left recurrent laryngeal nerve palsy caused by mechanical obstruction of left recurrent laryngeal nerve due to enlarged left atrium in mitral stenosis. There are two laws in vocal cord paralysis. First one is Feynman's law. In progressive laryngeal nerve, abductors are paralyzed before adductors. In incomplete paralysis, vocal cord brought adductors. In complete paralysis, cord will be in paramedian position. If it's unilateral damage, contralateral cord can partially compensate. Then about bad hypothesis, it is a widely accepted theory. Or a which adducts the vocal cord. If superior cord will be in cadaveric or intermediate due to that is a loss of adduction. Then about blood supply of larynx. Blood supply is from external carotid artery, which is further divides into superior and inferior laryngeal arch. About venous drainage, it drains into superior laryngeal vein and middle thyroid vein. Then about lymphatic drainage, above the vocal cord, it drains into upper deep cervical node. Below the vocal cord, into lower deep cervical node has no lymphatic drainage. Then about ligaments and membrane, they are thyroid membrane, membrane, cricotracheal ligament, and cricovocal membrane. Applied aspects, cricothyroidotomy, it's an opening made by making a slit or a small hole anteriorly in a relatively then it is important for giving local anesthesia to airway. It is essential for awake fiber optic intubation. Other blocks like SLN block and transtracheal blocks can be given. Laryngeal nerves most commonly injured by surgeries like thyroid, carotid artery surgery, lung surgery, and cardiac surgery. And in lung or esophageal cancers or due to enlarged lymph nodes. Right atrium, maybe due to cervical trauma or during insertion of LMA or in endotracheal tube. In emergency situation like can't intubate, can't ventilate situation, measures used are needle cricothyroidotomy, surgical cricothyroidotomy, and percutaneous self-tingus tracheostomy. Then a few words about laryngospasm. Reflex of protective reflexive glottic closure to prevent aspiration. Its exaggeration impedes respiration. Mostly it is self-limiting. Prolonged hypoxia and hypercapnia abolishes this reflex. Then risk factors are it is mostly related causes. Anxiety, GERD, upper respiratory infection or asthma, chronic smoker, usually in children. Then surgery related causes are throat or airway surgery, laryngeal surgery, injury, or anal surgery and cervical surgery. Then anesthesia related causes inadequate depth of anesthesia during injection or surgical stim due to airway irritation or irritant volatile anesthetic use like isoflurane or due to airway handling due to mucus or blood after expiration. About physiology, a multitude of mechanoreceptor are present throughout the larynx. Density of the receptors is greater around laryngeal opening. Posterior aspect of true vocal cords has greater density than anterior. So the stimulation induces short-lived glottic adduction to protect from aspiration. Then about diagnosis, harsh breathing inspiratory sound, which is stridor, exclude other causes of airway obstruction. Fall in saturation will be the late sign. Then about types, partial laryngospasm. In partial laryngospasm, there will be signs of inspiratory airway obstruction, suprasternal retraction, use of accessory muscles of respiration, paradoxical chest and abdomen movements will be there. On auscultation, inspiratory stridor will be there. In complete laryngospasm, there will be absence of breath sounds on auscultation. Late sign will be bradycardia and cyanosis. Then about the treatment of partial laryngospasm. Insert oral or nasopharyngeal ventilation, 100% FiO. Xylocort 1 mg per kg, injection 0.1 mg kg, and steroids like for complete suspend the anesthesia for 5 ml of 2 plus 5 ml of NS, 100% FiO2 can give us 1 to 4 ligno can be given. Thank you, sir.
Okay. So your poor audio and video. Did you mention anything about the cricoid cartilage and its importance? In your description of
for
your
rapid sequence integration.
larynx, did you mention anything specifically about cricoid cartilage, the shape, why it is a complete ring, and what is the advantage of that? Are you
So
able to
for
hear me?
giving rapid sequence,
Ah,
yes, sir.
Larynx
For
maneuver
rapid
or
sequence
cricoid pressure.
integration,
Eh?
eh,
So that is I don't I could follow you clearly because of the poor audio breaking. So without wasting much time, I'll just go to share my slides and show you all the important points that are required.